we are from group 14. We are going to explain about corticosteroid. So corticosteroids are drugs that are used to treat wide variety of disorders. For example, like asthma, arthritis, skin condition, and also autoimmune disease. So basically, it works by decreasing inflammation and suppress the immune system. Next. There are two major categories of corticosteroid, which is the first one is glucocorticoid and the second is mineralocorticoid. So I will explain about glucocorticoid. So glucocorticoid is anti-inflammatory drug that can fight autoimmune disease and also prevent damage to weight tissue at the inflammation site. Glucocorticoid is synthesized in zona fasciculata, the middle layer of adrenal cortex. So failure to produce glucocorticoid hormone is not as life-threatening as mineralocorticoid, where it's not causing fatal to the patient. Next one is corticosteroid physiological effect on metabolism.
The next major category of corticosteroid is mineralocorticoids. Mineralocorticoids plays an important role in sodium, potassium, and water balance. Besides that, it also increases the permeability of renal tubule and collecting duct to sodium. Mineralocorticoids is synthesized in zona glomerulosa, which is the outer layer in adrenal cortex. Lastly, loss of these hormones leads rapidly to life-threatening abnormalities in electrolyte and fluid balance. An example of mineralocorticoids is aldosterone.
Hi, I'm Joyce. Next, I'm going to talk about the hypothalamic pituitary adrenal axis. Next. The hypothalamic pituitary adrenal axis, HPA axis, is a neuroendocrine unit consisting of the hypothalamus, the pituitary gland, and the adrenal glands. As you can see in the visual, the hypothalamus is located in the brain and the pituitary is at the base of it, whereas the adrenal glands are on top of the kidney. The hypothalamus contains neuroendocrine neurons that secretes the corticotropin-releasing hormone, the CRH. It actually acts on the pituitary gland to stimulate the production and release of the adrenal corticotropic hormone, the ACTH, into the circulation. The circulating ACTH then induces the adrenal glands to synthesize and release corticosteroids such as cortisol and corticosterone. These circulating corticosteroids will undergo physiological processes influenced by the HPA axis and are also responsible for initiating a negative feedback loop on the HPA axis via activation of glucocorticoid receptor in the brain in order to shut down the corticosteroid production.
Now let's look at the pharmacological and adverse effects of corticosteroids. Next. So the pharmacological effects of corticosteroids includes the primary one, the anti-inflammatory and immunosuppressive action. The corticosteroids will inhibit the production and activity of the inflammatory cells and redistribute them to other parts of the body. Thus, the inflammatory cells will decrease in numbers and will suppress the inflammation and immune system response. And this is very important in solid organ transplantation so that the organ will not be rejected by the body by administrating corticosteroids through IV at high doses at the time of surgery. Besides, corticosteroids also regulate the salt-water balance in the animal's body by regulating the reabsorption of sodium and excretion of potassium at the renal tubules. And then, corticosteroids also help to treat endocrine disorders such as Addison disease, which is the insufficiency of adrenal, and the supplementation of corticosteroids will prevent the fatal adrenal crisis. Then, corticosteroids can help to treat musculoskeletal disorders too, like osteoarthritis. And there can be two routes of administration. First is the oral. If the oral fail, then we will use the injectable corticosteroid as the second-line treatment. Besides that, For hypersensitivity reactions, corticosteroids creams can be applied topically to treat dermatitis. And then lastly, corticosteroids can control asthma effectively. Inhaled corticosteroids can help to reduce the exacerbations and improve health status of the asthmatic patient, and this will help to reduce the morbidity and mortality of the patient.
We'll explain about the adverse effect of corticosteroids. So first, osteoporosis is one of the serious complications of oral corticosteroid treatment, where studies have shown that a number of decrease in bone mineral density, where the bone loss can be substantial and rapid. Next, the gradual increase of symptoms in asthmatic patients, which is due to the discontinued treatment, where the airway responsiveness return to pre-treatment value. Other than that, is the increase in infection due to bacterial, fungal, and viral infections, which can lead to risk in reactivation of tuberculosis. Besides that, the adverse effect is insulin resistant, where the hyperglycemic patient lead to development of diabetes mellitus, which result in increased amount of required insulin. Lastly, is the weight gain, where this is due to the redistribution of adipose tissue into the facial area, trunk, and upper back, which is known as Cushing's syndrome. This will lead to fluid retention and oedema.
So my name is Imran, so I'll be talking about the next few adverse effects of corticosteroids. Okay. So next is hypertension. These corticosteroids can cause increased blood pressure due to the fluid retention mentioned by Husna previously. Next is neuropsychiatric effects. Corticosteroids have shown to cause insomnia, mood swings, and even in severe cases, psychosis. Next is gastrointestinal effects. Corticosteroids have shown to show esophageal and gastric ulceration and also gastritis. Next, ophthalmological effects. Corticosteroids usage have shown to cause cataract formation and glaucoma development. This is because increased intraocular pressure of the corticosteroids cause damage to the optic nerve. Lastly, the cutaneous effects. Corticosteroid usage have shown to cause skin thinning, purpura, red striae, and also impaired wound healing.
Next, I will be talking about the mechanism of action of corticosteroids. Next. So basically, there are two types of mechanism of action involved around the corticosteroid. The first mechanism is where the corticosteroid will bind to the glucocorticoid receptor, which can upregulate or downregulate certain genes in the cell. So the first mechanisms basically happen when we have pain, inflammations, and infections on the cell. This will stimulate the cell by receptor, which will activate the nuclear factor kappa B. The nuclear factor kappa B activates the gene of the cell to produce mRNA. Then the mRNA will be translated into inflammatory cytokines, which will promote inflammatory response on the cell. So when the cell undergoes inflammation, the corticosteroid, which is a lipid-soluble hormone, will enter into the cell and bind to the glucocorticoid receptor complex. The glucocorticoid receptor complex will then bind and inhibit the nuclear factor kappa B. The nuclear factor kappa B is then inactivated and will not produce any inflammatory cytokine. Thus, the inflammation of the cell is suppressed.
Hello, my name is Ruth. I'm going to present the second mechanism. So the second mechanism also mainly focuses on an inflammatory response. Basically, if we want to understand why steroids is known as one of the most powerful anti-inflammatory response, we basically need to understand how the inflammation occurs. So the first thing first, when any triggers such as epinephrine, injuries, or bradykinin, all sorts of the inflammatory response triggered the phospholipid membrane, it will release arachidonic acid with the help of phospholipase A2. And therefore, arachidonic acid will be converted into two different types, which is prostaglandin and also leukotrienes, with the help of COX and also leukotriene, and also lipooxygenase. So both of these prostaglandin and also leukotrienes play a huge role in inflammatory response, such as prostaglandin in vasoconstriction and also vasodilation, and leukotrienes help in the allergic response. So how do steroids and glucocorticoids actually play a role? It actually inhibits the phospholipase A2, therefore no arachidonic acid will be produced, and also inhibits COX enzyme, and therefore no prostaglandin will produce. This is why, and this is the main reason why glucocorticoid is known as one of the most powerful anti-inflammatory drugs.